So today, a patient of mine said, Dr. Durwide, you saved my life. And I took that opportunity to sit down and delve into it more with her. The patient had a history of depression. And for some reason, at some point in her life, the depression got worse. And she kept telling people that there is something wrong with me. And, she's going to her doctors. Her doctors are treating her with the depression medication. They just think she's having a breakdown from the depression. But she's not sleeping. She's irritable to the point where she started feeling suicidal. My patient started feeling suicidal and they admitted her to the hospital. You know how they admit a patient to the psych ward and try to give them all these medications so that they can not feel suicidal. You guys, it turns out it was menopause. Yes. And this is what I find with my patients, right? They've been to other doctors. Like one of my patients was palpitations. So she had seen a cardiologist. They had done EKG, echo. They had tested her heart and they're telling her there's nothing wrong. You're fine. And she's saying there is something wrong with me. My other patient, the one I started with, it was depression. She was admitted to a psych ward because she was feeling suicidal. It was menopause. And so a lot of people feel that hormone therapy has gotten a bad rep, right? Hormone therapy has gotten a bad rep because everybody's afraid of cancer, which is real. But there are ways we can replace hormones that are safe. There are ways we can give you your life back that are safe. There are ways we can mitigate or reduce the risk of hormone therapy. My patient was telling me that one of her friends was like, well, now you're discharged from the hospital. You're feeling better now. Do you really need to go on hormones? She's like, yeah, I feel better, but I don't feel great. So a lot of women are just trudging through. Is that the right word? Or just getting through or just managing. Why are you managing through menopause? It is a hormonal problem. It has a hormonal solution. You can't sleep. You're getting more depressed. You're having palpitations. You're cold all the time. You're forgetting things. I have a patient who works in a bank and she works with money and she cannot remember what she just calculated or she cannot remember how much she just put in the till or whatever they do at the bank. It was starting to affect her job. It's menopause. You don't have to struggle through that. Menopause can last 10 years. Why would you want to live 10 years like that? Hormone therapy can be given in a safe manner. There are ways we can treat you so that you can feel better. You can thrive. You can sleep. You can be your best self. You can still be great at work. You don't have to be thinking maybe it's time for me to retire because I can't think anymore. I can't concentrate anymore. I can't remember things anymore. And it doesn't actually start completely when women are in menopause. I have patients 39. I have patients, even some patients early 30s, whose symptoms are starting to show. Brain fog. It's like, I just remembered something. What did I come down here for? Brain fog. Or I used to be quick and sharp at my job and now I'm slow. Or I can't sleep. Or the newfound depression. There are women who they've never had depression before and the depression, a feeling of hopelessness. One of my patients said that whenever she gets the heat wave, there's a feeling of hopelessness that she literally feels like there's no point to being alive. So menopause, hormone imbalance, women's estrogen, it can be disruptive to your life. You do not actually have to manage through that or just feel a little better. It's a hormonal problem. It has a hormonal solution. There are women who cannot take hormones. So there are women who I would give Effexor or non-hormonal medications to manage the hot flashes and the sleep. But Effexor is not going to really help it's not really going to help with concentration. Replacing the hormone is what's going to help with concentration. But Effexor can help with irritability. It can help with anxiety. It can help with the palpitations part. But I really feel strongly that women don't have to suffer through it because it's a normal phase of life. You're not your best self then. I mean, imagine not being able to sleep and having to go to a 9-to-5 job and having to concentrate at the 9-to-5 job. One of my patients is a professor. She has to grade papers. She has to read theses. You got to be able to be up for that. You don't want to be retiring early because you can't do your job. Menopause is a hormonal problem. There is a hormonal solution. There are ways we can mitigate the risks. At least talk to your doctor. Come talk to me. Let's look at your labs. Let's look at your health history. Let's look at what we can fix. There's something we can fix. I feel strongly about that. I just don't think people should just manage it. Like I said, it can last 10 years. For African American women, menopause can last 14 years. You want to be 20% of your best self for 14 years? No. When you can be 100% now, even before you get into menopause. So don't struggle through menopause. If you're having weird symptoms that are not even hot flashes, but you feel like you're not yourself, just have a conversation with your doctor. Or some people will be like, we don't check hormones for that. You're not in menopause until you've gone 12 months without a period. While that is true, you may not have the classic signs of menopause, that would make other people think maybe I should take this seriously. Like I said, palpitations, memory things, irritability, not being able to sleep. It might not even be the hot flashes or the night sweat that's keeping you up. It might just be newfound insomnia. It might be hormone imbalance. So don't ignore this, okay? Have the conversation. Get your hormones checked. Whatever is a hormonal problem can be solved with a hormonal solution. And, there are dietary lifestyle things. So I tell my patients, exercise, mindfulness, yoga, centering yourself. It's hard for some people if they have busy lives, if they have busy jobs, but for you to function at 100% in those spaces, and women start thinking it's them. They start thinking it's them, like their families now, like, I don't want to be around you. One of my patients actually said, I'm having relationship problems with my family because of my mood. Like, I'm snapping at everybody and I don't know why. It's a hormonal problem. It has a hormonal solution. Don't struggle through that. Don't just deal with that. Don't just wait it out. It could be 10, 14 years. So my patient was very happy because, all the doctors, her PCP, a psychiatrist, while she was admitted to the hospital, nobody thought it was menopause until she was talking to her aunt. Her aunt is a patient of mine. And her aunt was like, maybe you should talk to Dr. Durwade. She's my OBGYN. And then she talked to me. I did her labs. And yes, completely deficient in estrogen, testosterone, everything. FSH is the hormone from the brain that acts up when your hormones are low. FSH was super high. And that was the reason for all the irritability, the depression, the insomnia, the hot, the cold. And she said, Doc, you saved my life. Because this lady was ready to end it, kill herself. And all she needed was hormones. So don't be afraid. You can ask as many questions as you want. We can make sure your labs are fine, your blood pressure is fine, your mammogram is fine. Like, there are ways we can mitigate the risks. Don't suffer 10, 14 years of hormone imbalance. Okay, that's all I got. I'll see you next time.